Right, good afternoon everybody, and a very warm welcome to this meeting of the Health and Wellbeing Board. I appreciate the Chamber is a little on the cool side, but I'm quite sure the debate that we're going to be having will make us all feel much warmer as we go along. So the first thing on the agenda is to apologies and substitutes. Thank you, Kate.
Thank you. Yes, we've had apologies from Dr. Sarah Raystrick, Simon Adams, but we have Joe Ringshaw with us, Vic Allison, Mark Fitton, but we have Rebecca Wassell with us, Robert Mackey, but we have John Deverprium with us. Also apologies from Councillor Richard Morris and Councillor Shirley Webb.
Thank you, Kate. Thank you very much, and welcome to the substitutes. And I hope you'll have a good a meeting as I have. It's my first one I've missed a couple of meetings because I've not been here. So looking forward to having this meeting and the discussions. This board meeting is mainly about children and young people. So when we were having a discussion with the Director of Public Health, we felt it would be a really good idea to engage with younger people and to hear their voice as to what they think is important about health and well-being. And without further ado, I'm going to ask our Director of Children's Services, Adam, to make an introduction to Selina Rossano and Abby Salter. Thank you.
Thank you. Good afternoon, everyone. I could talk to you all day about children's participation, about the work of these guys over here. I'm going to steal your thunder if I do that, so I won't proceed to go much further in that regard. Suffice to say that children's participation, we were talking outside, myself and Councillor McKay were talking outside, and talking very recently following the latest Corporate Parenting Board. So children's participation, which is led by Selina, has been long-standing within Corporate Parenting Board, the way we structure Corporate Parenting Board, the preparation beforehand, and how we meaningfully garner children and young people's views. I use the word we very liberally, so I'll reframe that. She, Selina Rossano et al. It's not me who does that. It's me who engages in the conversation at Corporate Parenting Board and sometimes at some of those pre-meetings. I'll give you one quick snapshot, which I think is really pertinent for this board. Participation is all well and good, but what does participation lead to? Does it lead to evolving service delivery? Does it lead to development? Historically, Selina's led via participation in terms of care leavers, who once upon a time used to have what was called a pathway plan, which was yay thick. And surprise, surprise, young people didn't want anything to do with it because it was yay thick. So Selina and the young people she met with, consulted with, essentially redesigned the document. It's framed as plan on a page because guess what? It's a plan on a page. Young people are now far more inclined to engage with it. It's asking the pertinent questions that they themselves have identified. And by pure chance, because life doesn't normally work like this, when we had the full ILATS inspection in 23, it was just being embedded then, and Ofsted loved it. And as much as we all garnered in the credit for that, that's where the credit goes. So there's my introduction to Selina Rossano, and I guess I'll hand over to you, Selina.
Thank you very much, Adam, for that amazing introduction. And you would know how passionate I am with my job. Having my job. Young people chose me for this job, and it's absolutely honour and a privilege every day, particularly when we get opportunities like this. And thank you to Sam for inviting us at really short notice. And I know that if you did change your meeting times, there could be more involvement from young people, and I know that there would have been a whole list of young people would have, and I've seen youth cabinet members themselves how they like to come and take over meetings. So if ever is that opportunity in the future, I'm sure that they would love that. So I'm sort of speaking on their behalf. So my name's Selina. So as Adam kindly introduced me, I have got the honour of being Youth Voice Team Supervisor. As part of that job, not only do we support the Youth Cabinet, but we also support the Care Leavers Council and the Child and Care Council interview panels, and many opportunities involved regionally as well. So busy every day. And this is...
Yep, I'm Abby. I just want to say it's a pleasure to be here. I'm the first care experienced peer mentor apprentice. So yeah, it's just such a great opportunity, and yeah, thank you for having us.
Mm-hmm. So this is a really short notice, a little whistle-stop tour of Youth Cabinet, and I know they were really passionate for me to come and share their information, and they've worked extremely hard to put their manifesto together, and they're working extremely hard across the districts to really find those links in with you. So if there's pieces of work that you think, great, I could really help with that, then our information's here. So this is about the Youth Cabinet. So as you can see, there aren't that many members at the moment. There are lots of interest coming in. Just a little story about Youth Cabinet itself. My son, that's now 27, he was a member of the Youth Cabinet when he was 11 years old. So I've kind of been both sides of Youth Cabinet, and it's really good for me to feed back to him all the amazing work that they're doing. So these are the members at the moment. They have a chair, and she takes full responsibility, a bit like yourself at meetings. I'm just there to make sure there's a bit of food, take the minutes, and then whatever work's required. It genuinely is their meetings, they drive it, and they sort of decide what projects and what needs to happen. So that's my job within the Youth Cabinet. So who are they? They're a group of young people aged 11 to 18 who aim to provide all of the young people who live in Worcestershire with a voice that is heard and listened to by local, regional and national government by providing services for young people and other agencies. Sorry, I should have put my glasses on. There you go. I normally know it well off by heart. Who have interest in the views of young people, but they say they're not just that, they're much more than that. I'm not sure if any of you would have sort of been or heard of Make Your Mark. This is a national vote, so the children across the whole of the country aged 11 to 18, we had given it to all schools. Unfortunately, there was a bit of a blip within the system when they collected all the votes. So every single vote for Worcestershire, I know that I hand collected myself on one of these ballots because a lot of the computer ones didn't get sent through. Something happened, and as I say, you can't move back, you can only move forward. But I know that every single one that we had, which was over 1,000, we collected ourselves. So that gave a little bit of a snapshot of what our children within Worcestershire felt was important to them. So Make Your Mark ballot, I said, is a ballot for 11 to 18-year-olds, and it's a chance for young people to have a say with what's important for them. And surprisingly enough, as you can see for Worcestershire, one of their top votes, here you can see on there, was health and wellbeing, which is why it's quite fitting that we're here today. So young people said that it was important to them, and then from their votes, Worcestershire Youth Cabinet did a lot of debating, and they came up with their manifesto. And surprisingly enough, health and wellbeing was one of their top votes. And their aims and their plans are, just sharing them now, and I'll just read it through. If you do want to ever come to a meeting or find out more, I'm sure that you'd be more than welcome to come. So they felt that the hospital experience was something that they wanted to look at, and I know that they were part of the consultation around the new children's unit within Worcestershire Royal. So they were part of that consultation, and they're now planning to go back on a little visit and see were these changes implemented and what does it look like now. So that's a bit of an ongoing work for them. They're looking for feedback. So the main thing that their real key thing that they're working on at the moment is mental health. And what they're planning to do is create an information leaflet that will hopefully go out to all school children to give them a bit of a snapshot on, you know, if they're feeling like this, where they could go signposting. So we're working with, my brain has gone on a thing. So it's the new worker called Ellie.
Yes.
Adam, what's her name?
Holly.
Ellie, who is the new comms worker for Hereford and Worcestershire. I think it's through the mental health. Sorry, you've answered the question without opening your mouth. But she's working with Youth Cabinet on creating this. So we're collecting all sorts of information about the moment with services that are around. So they're also part of the SEND improvement, so heavily involved with the improvement plan going forward there. Is there anything you want to say on that, Abby, with what you've been involved with?
This bit there.
Oh, you can do, yeah, perfect.
Okay. Unfortunately, our young people are unable to attend in person today. However, they have asked us to speak on their behalf and convey their thoughts for them. They have heard on the radio that the government's promised to place mental health professionals in every school and that they wish to highlight this and the importance of this commitment, and they look forward to hearing Worcestershire's updates.
There we go. And then other parts of their manifesto is crime and safety. So knife crime, I think particularly at the moment in the news, it's something that's quite frightening. And even safety within schools is something that's a real top issue for them. And online safety as well, staying safe. So there's ongoing projects that they're working on, but the main one at the moment is the mental health. And then culture, media and sport, so equal access. So they want to sort of do a bit of a what's on in Worcestershire, test things out, but also make it a bit more accessible. So, you know, maybe create a little film about what they've been, what they've found out, to make things more accessible for other children that may or may not be interested in accessing those activities. So education and learning, so transition sport was a big one. You know, that emotional sport from years 6 to 7 and years 11 to 12. And I know they're working with Sarah Wilkins on that support, and then we're going to link into schools through that as well, so watch this space. And holistic education, advocate for more comprehensive education approach in Worcestershire that equips students with essential life skills such as financial awareness, communication and critical thinking. So that's another big thing that they're, you know, a bit like yourselves, it's scrutinising what Worcestershire is doing and really checking in where those positive changes are. So, and then this just sort of says who they're working with currently, but obviously the net is getting wider with more people seeing the positive work that's happening and those positive changes. So watch this space for that list to get longer. And there is your chance to ask some questions, and Abby will help with that as well, really. So thank you.
Thanks very much, both of you. And yeah, interesting presentation. Taking one of your first points here, hopefully when we hold this again, we'll be able to do it at a time when we can get some of the youth cabinet here. Now, are there any questions from anybody within the room? Yep, thank you.
Bring this to me.
Just introduce yourself, who you are, so that we all know who you are. Thank you.
Gareth Morgan, I'm the local policing commander for West Mercia Police, and I'm also currently the chair of the Worcestershire Child Safeguarding Executive Board. How can I get involved? How can my teams, if we're not, how can I come to one of your sessions and understand a little bit more? Obviously, there's a number of those elements within there that will cut across policing, and if possible, if you haven't got the gateways in and the support from West Mercia Police, I'd like to be a conduit and help you get whatever you need.
That is a brilliant offer, and I'll obviously, if we can sort of exchange information, then we will be in contact. And I should imagine the Youth Cabinet will be extremely welcome of your input, so
Yes.
thank you.
Lisa.
He's more important.
Oh, sorry.
I think more important. Just to add to what you were saying, Gareth, I think here comes a seed planter for everyone. I think there's something about a future health and wellbeing board, potentially, when it's a focus on children's being predominantly participation-led, and there's direct crossover with corporate parenting board, like really, really healthy crossover. But then on top of that, when I think about social care reform and what's around the corner with the Children and Wellbeing Bill, I think from a multi-agency perspective, that's when those conversations need to be happening. So I think there's an opportunity there, and I think this would be a perfect environment. Not yet, a little bit later down the line, where from a participatory perspective and a co-production perspective, that could be led on.
Yeah, it just strikes me that with the interest in health and well-being, it might make sense for public health to, it's not really the right word, but commission the Youth Cabinet to offer intelligence, insight, etc., not just on the range of programmes that we are responsible for, which you'll hear about later, but about the wider health and wellbeing work. And obviously we wouldn't want it done for free. We would provide funding in order to make that happen. We're all about an asset-based approach and a population-led approach, and we try to make our starting point what people think, what our residents think. And obviously programmes for young people should be no exception. So if it's okay, I'll get in touch with you about that, and it might help also with the funding for the youth cabinet work. So.
That's brilliant, thank you.
For myself, I was interested in how the county council, as an organisation, can promote the youth cabinet in terms of getting it wider known, more participation, and it'd be wonderful to have members of the youth cabinet and a full council of the county council. We've got one on Thursday, but that one's too soon, obviously. But looking to the future, it'd be wonderful to have the youth cabinet more closely integrated and involved. And so perhaps we can work towards that. And perhaps the relevant cabinet members for education and children's services might wish to take that one up. Steve, a bit more work for you.
Yes, thank you. That's the advantage of being able to chair a meeting, that you throw it this way as opposed to... No, I would like to say, though, that in relation to all this, one of the slides that came up there in relation to the Make Your Mark, it just goes to show how many children or young people were determined to have their own say in what, what makes their lives better. And in particular, just sort of seeing the numbers, the numbers game on that in relation to the number of votes that were cast in respect of health and well-being as being the major issue. I think it was something like 284 if I picked it up very, very quickly. It took a long time to count all those votes, I know, because I was there and took part in that. But it was the top issue. And I think that's the important thing for this board. And again, just looking at one of the points that was made on there was about destigmatisation, destigmatising SEND issues in particular. And in relation to the local authority that you mentioned and their part in it, well, one of the things that we're trying to do and we're trying to say is that wherever possible, young people with special educational needs, disabilities, wherever possible, where it's the right thing to do, then those children should be in mainstream schools. And as they point out, and as you pointed out, destigmatisation is everything if we want to make it the right line of the way we should go for those particular young children, young people. So I think it's sort of right to say that these young people, they are deserving of a voice, and they're deserving of our best services as well. So yeah, I'll leave that with you.
Thanks, Steve. Yeah, that's very helpful. Thank you. And as I said, I think it is interesting of all the kind of things when you think about young people that you wouldn't think that health and well-being would be at the top of their list, and surprising as it was. And of course, being mental health with all the pressures that young people have on them today, certainly up there with it. We have a question. We've got two questioners. I'm sorry, I don't know your name, so perhaps you'll introduce yourself. Thank you.
Thank you. It's Jo Newton from Worcestershire Acute Hospitals, and thank you first of all for your feedback and help actually in helping design some of the artwork in our children's wards, because actually when we think about it ourselves we never quite get it right, so always having the children and young people involved is really great. And I suppose I just wanted to expand that in terms of when your young people are thinking about health and well-being, particularly around an acute setting, because quite often it's only at the point of crisis where they might need to go into hospital, and it might not be something they're familiar with. And I've come across recently a really interesting example where they've used technology to almost help young people walk the walk with their carers and patients. And I just wonder whether it's something we might be able to explore to do in our own local hospitals with the support of your young people. So I suppose that's in a way an offer. My question to you was just around transition, but transition from sort of children into the adolescent and early adult age group, because that's often a problem in the the hospital, just in terms of, obviously teenagers don't like to be on what they see as children's wards and vice versa. And I just wondered if you had any feedback or thoughts on that.
I don't have any personal experience of it, but I know that from, you know, the many years I've worked for Worcestershire, and I think it'd be 20 this year, you know, young people do tell me, and I have experienced, you know, that being in the wrong place. So I think, yeah, that sort of user-friendly environment where our children tell us what's important for them and us listening would really make a difference. So yeah, definitely. And our youth cabinet are actually meeting tonight, so it'd be quite useful for us to take this information back to them. So yeah, thank you. Anything you want to say, Abby?
Personally, being care experienced, I actually attend the QE in Birmingham for liver appointments, and I noticed when I turned 18 I didn't get no advocacy people with me or any help from anyone. And I actually remember going for it's called something where they put something down your throat and look at in a camera in your stomach, and I remember going there and I had no support then, and I was on my own because I was care experienced. And I remember it being such a traumatic experience because, like, you go from the lovely wards of all the pictures and everything, and then it feels like, oh, it feels like a prison cell sometimes. I had no one to talk to, so I feel like maybe people could look at that and maybe expand the age range up a bit to maybe 25, because we get help from the duty team until we're 25 years old, so maybe not just cut it off at 18 and say, here you go, maybe expand it a bit till 25 and offer more advocacy people to be there for people. So, yeah.
Just also adding on to that, and I know that, Abby, you had shared that experience with me, but the thing that I sort of took away from what Abby had shared was she was really anxious about going for this procedure that she didn't really know what was happening, and everyone's so time limited, and they're almost anxious to get people in and people out. So if you're appearing anxious, there isn't that time for anyone to spend to go through it. So I think that you felt like a bit like, well, she's one that's upset, or she's one that's like this, and categorised almost. But actually, for anyone to go through that experience, I think I would probably be feeling exactly the same. So yeah, thank you, Abby, for sharing.
It's okay. Thank you.
So Chris Roberts, Citizens Advice Bureau. Music to my ears. My degree is in youth and community work. I have 3 adopted children, 2 of whom have care experience, as is often the case. Couple of observations. The first is, I think it's absolutely brilliant that young people have this space. I think there is a challenge to the rest of us not to just leave it as a separate and segregated space, because my experience is definitely that what's good for young people is pretty damn good for the rest of us as well. And I think sometimes it can be easy to say, okay, we've ticked that box, they've got a room, they can talk, but actually we're going to go and have the big boys discussion over here, if you like. So, and that's a challenge for us. How do we do more than just send questions and actually start saying, is it possible to get young people more involved? The other thing, I was really pleased to see your mention of holistic education. So at the Citizens Advice Bureau I've run, we've recognised there are 3 key life transitions where we can intervene for the maximum effect. Starting a family, retirement, and leaving education, because those are the 3 points where life tends to change the most dramatically. And I'm not even going to ask for any money, because we've got money from someone else to do an outreach project from Bromsgrove District Council, and we're planning on working with Heart of Worcestershire to do, basically to train up the 6th formers to advise the 6th formers as CAB advisors. And also, fun enough, on the hospital thing, I want to have a chat with the acute hospitals, because we've got some ideas and plans there that may help with some of those things. But no, great work, keep it up, and please do keep knocking on the door, and when you get your foot in, don't go out again. All right?
Thank you very much. Thank you, Chris. And thank you, Selena, and thank you, Abby. It's been very interesting, and I'm sure that we've all learned a lot from it, and keep up the good work.
Just to say, if you were searching up currently Worcestershire Youth Cabinet on the website, it's all up for a refresh and an update. So it's that time now when everything's knitting together. So they are next week meeting with the comms team to update the website. They're going to create a little animated video. So watch this space, but it's building and it's really, really exciting. And I feel really proud that I'm part of their journey. So, but thank you for having us today.
Thank you.
Thank you both. Thank you very much indeed. What you can tell I'm a useless chairman, and Sarah did a much better job when I was away, because I managed to go from item 1 to item 5 in one fell swoop. So
It's fine by us.
it's fine by you, is it? Well, yeah, I don't think Sam will be very pleased with me. She's no. So anyway, so we're going to get back on to the agenda. So I've got to. First of all, I should have asked, are there any declarations of interest before we start the meeting? I take that as a no then, thank you, well done, good. And we have no public participation, so we can move on from that one. And you've all had a look at the minutes, and I'm sure you're all happy with them, so I can sign those minutes as and when. Thank you very much indeed. Before we get on to the next item, I do have something to do, which is to say a big thank you to Liz Alte, our public health consultant, who is retiring. You're welcome. Liz is one of the most experienced public health consultants in the country. She has expertise in all areas of public health and stepped up to become interim Director of Public Health when the council needed one. Thank you very much. Supporting the team really well through that period. Her work on children's health has been particularly outstanding, and her positive impact will be felt for many years to come. The public health team and colleagues across the whole system will miss her terribly. But she has great reasons to retire, most notably so she can spend more time on her even more important job as mom and grandmother. Worcestershire has been so lucky to have Liz, so on behalf of everyone, thanks to her for everything she's done for the county. Thank you very much indeed. And a round of applause, I think, for Liz. And now that I've made you horribly embarrassed, we'll move on. But thank you, Liz. Thank you very much. Thank you. Right then, we're now back on track, everybody. You'll be pleased to know. And we get to item 6 on your agenda, which is the NHS Children and Young People Programme Board. It was going to be presented by Maria Hardy, who's not going to be here. So we have the privilege of hearing from the man himself, Simon. Thank you, Simon.
Thank you, Chair. And I'd echo response on behalf of the NHS for Liz, who worked for us for many years as well, and made a huge impact in both the time within health services, but also at the council as well. So I put that on record on behalf of everybody in the NHS. Thank you, Liz. As you said, David, Maria Hardy unfortunately isn't very well this week, so I am going to present the report. I will do my best to answer any questions. If I am unable to, I'm happy to get back to people in writing at a later point. The report is as read, hopefully. What we tried to do with this report, we're reporting on the work of the Children and Young People Programme Board. In essence, the work of the local programme board is to capture both national priorities. So you'll see that there's a range of national NHS transformation programmes of work that relate to children's health services, and we align those with local priorities, which are our Worcestershire priorities, which Adam will touch on, I think, in a bit more detail. So hopefully the report summarises where we have got to with all of that very important work. You will see there are 2 particular local priorities, which I suspect people will be most focused on. Both of those have arisen from the SEND inspection work that we have been undertaking in partnership with County Council colleagues. You will see they really relate to 2 things: waiting times, and interestingly, in relation to the start of the meeting, to co-production, to working with communities, with service users, working with families. And I'm sure Adam would agree with me, one of the outcomes of the inspection has been a real reset and refocusing of that co-production agenda, a real reminder of why it's important and how you can do it well. And actually, I think there are some very loud and constructive voices in this space, and they are really helping to shape our improvement. And I think it's only right that we should focus in on that. You'll see on page 10, so paragraph 5 gives some overview of the main children's health outcomes. It says in the report it's a mixed picture. I think I would agree there is definitely some room for improvement in some outcomes, But on lots of them, Worcestershire does a lot better than the national average. And I think we would expect that, wouldn't we, given our demography and how most of our population gets to live. As you move through the report, page 11 talks through quite a distinctive rise in the number of people, children and young people, with an education, health and care plan. So this is something really the council is experiencing through wider demand for children's services, through the SEND agenda, but specifically children in school who require additional health and education support. And an increase from 4,000 to 7,000 over that 4-year period actually really starkly illustrates the challenge that I think we are all working with. We're working hard across the NHS in particular to try and resolve what in essence is a mismatch between a rapidly increased demand for some of these services and the capacity that is available locally. So that isn't something that somebody can wave a magic wand and resolve overnight. For instance, I think the report describes we've made available £800,000 in this year for investment in additional capacity to bring down some of those longest waiting lists. As things stand today, I think we've only been able to spend about £100,000 of that because it all relates to the ability to recruit suitably qualified staff that aren't around just sitting waiting for opportunities to come and take new roles. So part of this will be an upskilling and a development of the workforce as well. You'll see that the report goes on to describe, and there's a chart at the bottom of page 13, an increase in requests for autism diagnosis assessments, and ADHD follows a similar pattern. That's a pretty significant increase. Paragraph 16 says 200%. I'm not sure that's quite accurate when reading that this morning. It looks more like about a 30% increase to me on what was a consistent demand pre-pandemic, which is what we actually have to look at. And then the report finishes with the more national NHS priorities around infant mortality, diabetes, epilepsy, obesity, asthma, and elective and cancer care. I would just draw out a significant focus for us in our planning for 25-26 is to work through just how we can both secure investment in some more additional capacity on top of what's there for autism and learning disabilities and ADHD, but also the children's mental health, which I think, again, colleagues mentioned at the start of the meeting. The demand changes in some of these service areas is going to require quite significant capacity changes. We're going to have to plan through and find an ability to resource that. But what I would say from my perspective is I do think this is an area where the NHS local authority partnerships are very strong. Adam works very closely with Mary Gay, Jade Brooks, Maria Hardy, who work for the NHS. It is a success story, the way we are managing to combine efforts to try and improve outcomes for children and young people. I think it's been helpful that some of the inspection regimes more latterly are recognising that. Maybe that wasn't the case 3 or 4 years ago, but we are doing better in the inspections as a result of that joint endeavour, and it's certainly something that we would plan to continue. So very happy, Chair, to take any questions that I am able to answer in addition to that.
Thank you. I'm going to kick off with a question of my own first of all, which is I'm very interested in looking at the rise in EHCPs, and I looked at, from January 20 to December 24, went from 4,000 to 7,000, a significant increase. Simon, what do you kind of ascribe that increase to? Is it we are better at diagnosis, or what are the factors that are affecting that rise?
Yeah, I mean, that's a really difficult question to answer because it certainly isn't an overnight increase in health need. It is a lot to do with awareness, I think, that people, parents, families, communities become more aware of the additional support that is available. And actually, the more you provide, the more aware others become. I think there is definitely, and Liz and public health colleagues will be able to comment on this, the pandemic did have an impact on health need and education need. Without a doubt, it changed the shape of some of our children and young people communities and what they need from us. I think some of that is reflected in there. And there is a national context. Our increases here aren't dissimilar to what is being seen all over the country, actually. So it's one of the things I often talk at national meetings about. with NHS colleagues that, look, we've got to really reset how we are thinking about some of these services. We haven't traditionally spent enough time doing demand and capacity modelling for these services. And because demand has changed so considerably, it is really, really important that we get our heads around how we do that and then how we prioritise and organise resources accordingly. Adam, I don't know if there's anything you wanted to add around EHCPs.
No, I fully agree with you. I think in addition, there's also a perception by some that the only way to access service provision for a given child or young person is by virtue of having a statutory assessment. And if you look at the direction that the DFE are indicating will be taken forward, it's very much around inclusion, and rightly so as well. So when we think about individual children, socialisation, etc., 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 the current education agenda is entirely about inclusion. Ironically, you know, we've really recently had the Education Sufficiency Plan presented at Cabinet and agreed by Cabinet, and a major focus is around inclusion. Sometimes when I say comments like that, it's misinterpreted by other people, and it's perceived as a veiled accusation that people are inappropriately accessing services, and that's not what I'm saying at all. All I'm saying is actually, if you don't need a statutory assessment, why pursue a statutory assessment, especially when the framework is now, and it links into what Simon was saying, is now moving, including the inspection regime framework, is moving to one of inclusivity, as opposed to you need a statutory assessment in order to access X, Y, and Z. None of that negates from the fact that we all know there's a national, ongoing national lobbying, which I think has been recognised fairly loudly and fairly clearly, that the framework itself, the SEN framework and the associated legislation needs to be reviewed.
Yes, thank you, Chair. My comment sort of picks up something that Simon referred to about communities. That if you look at that paper, you can see enormous investment going in both from the council and from the NHS. Enormous extra investment on top of significant investment. And real improvements being made. But when you look at some of these graphs, you think, where does this end? And so I think we have to, as a society, make a real conscious decision not to leave everything to services, not to leave everything to NHS services, not to leave everything to social care services. And, one of the oldest proverbs in the book is, takes a community to raise a child, or takes a village to raise a child. And, hopefully you'll see some of the work we're trying to develop in the family hubs to try and build on that, to build on the circumstances that children grow up in. Because a child is not just a collection of symptoms and assessments and performance. They are a product of the environment that they come from. And to back that up, to hopefully support that, you'll all be familiar with the work we did on LSOAs, lower super output areas, where we looked at hospital admissions and pinpointed very small areas that were producing an awful lot of demand. Well, we're doing exactly the same with children's data as well. And then we'll follow that up with investment, public health investment of time and resources into those areas to see if we can support the sort of the power of community that we often talk about to improve health and well-being. So we need to provide services, and personally I think the progress is there for all to see, but we can't leave it all to services, and we need to invest in communities as well.
Yeah, thanks, Liz. Yeah, absolutely right. I mean, certainly the EHCP is a significant issue for the council and for children's services, and yeah, I think Adam's kind of hinted at it, but it can be seen sometimes as a passport to extra support, which of course it is, but of course it's primarily for the benefit of the child. It's up for all. I mean, at Worcestershire County Council, it's children first, as is in the title of it, and that's where they should be, right at the forefront. Any other questions for Simon? Or are you going to get away easily? Ah, how unfortunate. Looks like that's it. Thank you, Simon.
Thank you. Thank you, colleagues.
Well, we're on time, so you'll be happy to be that one. Right then, we're on to agenda item 7, Worcestershire Children's Services Yearly Report. And it's sponsored by Councillor Steve Mackay, the Cabinet Member with Responsibility, and going to be presented by Adam Johnston. So thank you. Over to you, Steve.
Yes, thank you, Chair. The yearly report, reflects significant progress and the ongoing efforts to improve the lives of children and young people in Worcestershire. This year's report highlights the successful reintegration of children's services back into Worcestershire County Council following its 5-year delivery under Worcestershire Children's First. Notably, the recent Ofsted inspection in December 2024 acknowledged the seamless transition and overall improvements, emphasising consistent service delivery and positive outcomes for children in care. The report showcases key priorities aligned with the Children and Young People's Plan, focusing on the best start in life, access to mental health and wellbeing support, timely educational health and social care interventions, and collaborative safeguarding efforts to keep children safe. Particular attention is given to improving special educational needs and disabilities services, where ongoing work aims to reduce long waiting times and enhance co-production with families. The report also emphasises strengthened governance, arrangements for the SEND local area partnership to ensure continued accountability and effective service delivery. The report itself reflects a collective commitment to improving outcomes for children and young people through collaboration, strategic planning, and a focus on both prevention and targeted intervention. Adam.
Okay, so in many respects, it could have been either Simon or I who essentially reported on SEND and essentially the conversation that we've just had, just by virtue of the fact that it's a local area partnership, clues in the title, essentially. So I'm not going to repeat things unnecessarily. Suffice to say, I'll just touch, just to enhance a little bit on what Simon said, just in terms of some of the deep dive stuff that the DFE have been doing. So broadly speaking, in terms of the children's overview, given what I've just said, it's a brief update with regard to, and you're absolutely right, Worcestershire Children First, clues in the title, but we're no longer Worcestershire Children First. So a quick update in that regard, quick update with regard to the recent focused inspection and the relevance for Health and Wellbeing Board, and indeed SEND, and our journey so far in terms of improvements. An update with regard to the work of CYPSP. I'll put myself to the test because I'm so accustomed to saying CYPSP. So we all know the next question. What's that stand for? Children, Young People Strategic Partnership. And now I don't have to say it again. And then finally, I've got a formal ask of Health and Wellbeing Board, which I'm hoping you'll all be agreeable to. So just in terms of Worcestershire Children First, long story short, back in 2016, I think most people are familiar with it. That's when I joined the council. I'm hoping that it doesn't directly align to me joining the council, because that was the same year that Children's Services got an inadequate inspection. I hadn't been here that long, to be fair. Net result of all of that was that ultimately the DFE placed an improvement notice upon the council with an expectation that an alternate delivery model be implemented. That manifested as Children's Services going into company, also known as Worcestershire Children First. I think what's important just to know, I think it's really important, it's easily lost, is the improvement journey that Children's Services were well on their way in terms of progressing, actually resulted in a change in judgment from inadequate to requires improvement before Children's Services went into company. So not to put too fine a point on it, do I think that Children's Services going into company results in good Ofsted outcomes? No, is the answer. But nonetheless, we were subject to an improvement notice. Children's Services went into company, WCF, October 19. It was a 5-year contract. There was the option to renew that contract. During that period of time, the requires improvement judgment ultimately became a good judgment in 2023. I've just realised it's getting closer to Ofsted coming round again and doing a full inspection. And then further, as Councillor McKay's just alluded to, we've also had a focus visit as well more recently. The net result of all of that was that there was really wide consultation as to whether or not there was merit in continuing with an extension of Worcestershire Children First, or simply allowing the contract to lapse and Children's Services reintegrating with the County Council. And that was the decision that was ultimately made. So I guess my update for everyone is that happened. It happened as of the 1st of October. Seamless were the words that Councillor McKay used. I'm not taking credit for any of this. As is always the case with stuff like this, the calm exterior belies the frantic planning and progress and all the rest of it that is inherently in place, but well practiced by virtue of the fact that it's the same group of folks who prepared Children's Services to go into company. So it's essentially, well, let's repeat the process, but we've learnt from our mistakes. Most importantly, zero impact on children and young people. For all intents and purposes, it was a lift and shift exercise. Existing teams, same line report, same structure. We're just going to put you over here in the County Council. So the joke was, oh, so my lanyard changes and my email address changes. But actually, it's not so much of a joke, because that was the felt reality for the majority of the workforce. As Councillor McKay says, Ofsted, they can be a bit sneaky sometimes. So what they said their agenda was didn't fully align with what they actually questioned all of our social workers around, because each and every one of our workers, and indeed children and young people, were questioned by Ofsted in terms of, has there been an adverse impact on you in any way? The consistent answer they got was, nope, barely noticed it. So there you go. That's my update with regard to reintegration back to the council. In terms of the Ofsted inspection, again, Councillor McKay's already alluded to it. Ofsted undertook a focused visit on the 3rd and 4th of December last year. It's important to note that focus visits, unlike a full ILACS inspection on Children's Services, which is subject to a judgment, inadequate, requires improvement, good or outstanding, a focus visit isn't subject to a judgment. You essentially get a letter, but the letter's always clear, and people can determine for themselves how well or not a local authority has done. The focus obviously was children in care, but specifically children in care with a standalone focus on the experience of children with disabilities, standalone focus on the use of illegal placements. And as I say that, I'm mindful of how that sounds. Every local authority, I'm afraid, sometimes has to utilise unregistered illegal placements. The difference between one authority and another is how robust you are in terms of your management and oversight and scrutiny of such placements, and how proactive you are in terms of moving a child on. And obviously, other than spending the best part of 30-40 minutes with me and the senior leadership team, Ofsted weren't interested in us, and rightly so thereafter, focused the entirety of their time with parent carers, children, young people, and social workers themselves. I've attached the letter to the report. The letter speaks for itself. It's a really, really positive letter. Consistency in terms of service provision is a bit of a standout when we compare it to the ILACS inspection. And remember, the ILACS inspection had an overall judgment of good. Good experiences for children with disabilities. The language Ofsted use, majority and most, majority and most. You'll never read anywhere, even in an outstanding authority, every single child. So we like reading most. Most is a good outcome. They specifically, for the purposes of Health and Wellbeing Board, Ofsted noted that children's physical and emotional health needs were well met by social workers within the context of ensuring that children had regular checkups. They were seeing their dentists regularly and opticians as well. There was direct reference to the in-house emotional health and wellbeing service, Anchor. So, although by in-house, this isn't just social care staff. These are CAMS workers we have psychologists. It's a bit of a multi-agency setup. Very, very small team, but a very, very effective team that pitches their emotional health and wellbeing at the lower level of support for looked after children. That team can never ever be big enough. Every single looked after child has experienced trauma at the end of the day, but they like that. And then a direct correlation to exactly what Simon was talking about. Everything links in, as is always the case. So they spoke about delays with regard to waiting times for neurodevelopmental assessments, but we were able to talk to them and reference Ofsted themselves to the fact that, okay, well, you're talking about a specific priority action plan that we are all over, we being the local area partnership, and yes, it's a struggle, but yes, we're making progress, and they're aware of that, obviously, so they picked that out. So I guess from a health perspective, they were the standouts from the inspection. So I won't add any more to that. Suffice to say, a positive letter, a really encouraging letter. Specifically in terms of the Children and Young People Strategic Partnership, that's the second time, got it right. So for all intents and purposes, CYPSP is a subgroup of this Health and Wellbeing Board, and it's specifically focused to implement the Worcestershire Children and Young People's Plan. So essentially, there are 4 standout priorities. Best start in life, so we can look around the room to know who leads on these things. Access to emotional health and wellbeing and mental health support. Access to the right education, health and social care intervention, working together to keep children safe from harm. So I don't think anyone's going to argue with that. And in its own right, CYPSP then has 5 subgroups. Those five subgroups being the Children Early Help Partnership, Best Start in Life Partnership, we'll send Liz Oltay off with a bang soon enough, Send an Alternate Provision Committee, this is a mouthful, Children and Young People Mental Health and Emotional Wellbeing Partnership, and then finally the Worcestershire Safeguarding Children's Partnership. So Councillor McKay chairs CYPSP. We last met at the end of 2024, and I'm certainly not going to reinvent the wheel. So for example, the Early Help Partnership presented their annual report in March 2024. The Early Help Partnership strategy is going to be updated to reflect the care review and keeping children safe, helping families to thrive, which was published in November 24, which links into the social care reform, which is going to be the big driver. I was going to say for children's social care from a multi-agency perspective, frankly, in terms of the direction of travel. Worcestershire Safeguarding Board annual report, I'm not going to say anything. Suffice to say, it was here, and it's been everywhere. Overview and scrutiny, cabinet, etc. Suffice to say, really good overview with regard to that. And then we have the Public Health Best Start in Life Action Plan 24-26. That's a separate agenda item today. So Liz will not be appreciative if I start talking to that in any more detail, although it has been presented in detail to the Children and Young People Strategic Partnership. And then, of course, we've got SEND. So again, I feel like I keep saying Simon, but it just demonstrates the crossover between our respective agencies. Simon's spoken in some detail around SEND. What I would talk about, or in addition, is from a SEND perspective, the level of rigour and scrutiny, frankly, is up there. It's unsurpassed. So as a partnership, so myself and Mary Gay and others are regular attendees at the overview and scrutiny panel, where frankly punches aren't pulled. You know, what's your progress, and if there isn't, why? And more often than not, there are public participants with regard to that. Everyone absolutely has a voice. But then alongside that, we've also got the DFE themselves, who are charged with undertaking quarterly deep dive reviews. So the first of those quarterly deep dives took place mid-December last year, 16th of December last year. Again, I've attached the letter to the report just for people's interest. But generally speaking, if you think about the context, inspection happens late spring, early summer last year. Lots of gathering the troops, lots of working out how we're going to move this forward, how are we going to do this collectively and meaningfully. And a very short while afterwards, DFE land to undertake a formal deep dive. The deep dive was specifically on the priority actions, which Simon outlined in terms of waiting times and co-production. Letter, I won't take you through it unnecessarily word by word, line by line. Happy to take questions on it, but it's a positive letter. It's a positive letter that pretty much aligns to what Simon was talking about. Genuine partnership work, genuine co-production, improvements in terms of communication, and I think a recognition of the inherent struggle there is. So when we think about total numbers of EHCPs, and also, to be frank, we think about perhaps a Worcestershire specific thing that I think is relevant in terms of the lived experiences of a number of parent carers and where that leaves them at this moment in time. You know, these are things that we need to work through and work hand in hand with those parent carers and their representatives as well. So a positive letter, suffice to say, as ever, do more, do more, do more, and we are trying to do more, and we will continue to report on that accordingly. And then the final element that's relevant to CYPSP, have I said it wrong? No, I haven't, I don't know, is the Children and Young People's Mental Health and Emotional Wellbeing Partnership. So there's been huge focus on this. It's had various iterations before it got that title. A real focus on the likes of me, to be blunt, and the social care workforce. What do we do? Where's the service for this particular cohort of children and young people? We're pulling our hair out, etc., etc. Lots of focus work that's been led on by CYPSP and then reported to CYPSP, examples of which are real objective case studies and analysis from a multi-agency perspective. Let's look at Joe Blogs. Let's look at what Joe Blogs' experience was. Let's look at the good and the bad from a social care perspective, from an ICB perspective, from a health and care trust perspective, from a police perspective, from everyone's perspective. And let's determine what the learning is from that. That was a good exercise, difficult, but a really, really good exercise. Long story short, that essentially got us into a place where there was agreement that, amongst other things, there was agreement that there needed to be some investment in Tier 2 provision. In other words, preventative assessment, which from a broader perspective aligns with the direction of travel, aligns with the way we are all collectively undertaking and running our respective service areas. Please don't quote me on the amount of money because I'll get it wrong. And those colleagues aren't here today. Sue Harris set out, but it's just shy of about £900,000 being invested at Tier 2 level. So when we think of that cohort of young people where we're getting calls at silly o'clock at night around them, where they are pre-CAMS, pre-diagnosis, and yet their needs are incredibly challenging, they're incredibly complex. We don't have the expertise. This is very much investment in terms of, well, how do we avoid their escalation and how do we make sure that we intervene at an earlier stage? So I welcome that, and that's very much a result of that particular working group. They, in their own right, articulated that, amongst other things, at a recent overview and scrutiny panel, and overview and scrutiny panel will have them back. I can't remember the date, but they will have them back in terms of, right, let's see what the progress is. There's a commitment to invest, so we want to hear that you have, what are the services, what's the net result of that. But that's a move in the right direction and one that I welcome. There's further work that it's at exploratory level at this moment in time. I'll just touch upon it really, really briefly. and that's potential grant monies that will be available in the future from the DFE to develop provision for that cohort of children that I'm referring to. But for that to be meaningful, that's very much about social care, forming a link with an external provider and a genuine partnership with an external provider in terms of running that provision, but also linking in with ICB in terms of what could this look like from a day-to-day basis in terms of working alongside a young person such as that I've described. So difficult work, tough work, no easy answers, but movements in the right direction, basically. And as I said, as ever, scrutiny like there's no tomorrow in terms of making sure that we're actually delivering on it. And then the final element is the ask, which is also related to SEND and SEND's improvement. So as part of the improvement plan, the governance structure has been revised. It's far simpler. I remember when I first looked at the governance structure and it looked like a spider's web, if I'm honest with you. It's far, far simpler. We've now got an independent improvement chair who has been appointed, and actually Jane Friswell, who starts this Friday. So she will be chairing the first executive board this Friday. And that's a really, really important progression element in terms of SEND improvement and SEND delivery. The ask is for that executive board, from a governance perspective, to feed directly into the Health and Wellbeing Board. So instead of the likes of me feeding into Health and Wellbeing Board and talking incredibly positively about all the amazing progress that we're making, better and more appropriate that an independent chair who's specifically charged with that mandate and who will put the likes of myself and Mary Gay from the ICB and others through the test, reports herself to the Health and Wellbeing Board. So there you go. That's my ask. And there endeth the report.
Thank you, Adam. Very comprehensive review of the report, and thank you, Steve, for the introduction. And thank you for the report and its detail and the good news that it tells us. I mean, I also like the transparency that you've highlighted. That we're still a bit lacking in the neurodevelopment assessments, but we're on board with it. But I'm pleased that it was there as a point to note. It's not a question, it's just a comment really. I was on the Children and Families Scrutiny Panel when it was suggested that the Worcestershire Children's First, as it was then, was taken back into the council. And I think it would be fair to say amongst panel members there was a certain amount of disquiet and tension and concern that it would all go pear-shaped and there would be problems and so on and so forth. And that's not been the case. I know you say it was just a lift and a shift and basically they are on with it, but even so, there's opportunities there, Adam, for things to go wrong, and it's a testament to you and your team that it hasn't done so. So thank you and well done to everybody involved in that one. And I'll just do the ask. Yeah, absolutely. No problem with that. Yeah, we're happy to deal with that one. Yes, of course. Are there any questions? Well, I think you did the report so well that there aren't any questions. So well done. Thank you very much. Right, so we are doing well for time, and our next agenda item 8 is Best Start in Life. Board sponsors are Director of Public Health, Lisa, and it's going to be presented by Liz and Claire. Thank you.
Thank you. So it's been referred to already by Adam. Thank you, Adam. And so this is about our Best Start in Life partnership and our new Best Start in Life action plan. So I'm delighted as well, before I leave, that we actually have now launched this and we've got a plan in place. Let's move the slide. So why is this so important? So the Best Start in Life underpins probably all the other plans and initiatives and services that we've talked about. So it's really important that what happens in pregnancy and early childhood influences health and well-being, etc., into adulthood. This is because babies and children's brains develop so quickly and so much during that period. So it's a crucial time, crucial window to influence it and to have that opportunity to support the family and children. And of course, there are huge cost benefits in doing something early. So if we do it early on in life rather than wait till adulthood. So the national context for this is a few years ago, there was a national policy paper about the best start in life and very much identified the first 1,001 days. So our plan is Worcestershire's approach to that. This is the Worcestershire plan. So locally, what have we done then? So this is how it fits. So the best start in life is a key priority, as you heard Adam mention. It sits within the Children and Young People's Plan. It sits as part of our health and wellbeing strategy. It was identified, and it's also a priority in the integrated care strategy. So our plan for Worcestershire fits all these three plans and is also a chapter now in our health and wellbeing strategy. So how we're doing this, we're working together as a system. So this isn't only about services, it's working with our communities, as Lisa was talking about, working with our families, working with parents, working all together, VCS services, statutory services. We have a partnership and an action plan, and it's very much about looking at prevention and early intervention. So it's supporting families, providing information to help them thrive, but also making sure that we intervene as early as possible, should we need to. So the partnership has been set up. It was set up last year. It meets quarterly. As I said, the partnership has system-wide representation. We had a workshop. We've co-produced what the action plan is, what the priorities of the action plan is, and that was based on evidence and data and insight from all those attending the workshop and all stakeholders. We have a number of task groups and plans, and we launched the action plan last year. And as I said, it ensures that prevention is everybody's business and it's across the whole system. So governance, again, I don't want to repeat what Adam said, but just as there's a picture of it. So there you've got the CYPSP, Worcestershire Children's Young People Strategic Partnership in the middle, which feeds up to this Health and Wellbeing Board, and the 5 subgroups that Adam referred to underneath. The best start in life is the pink one on the end, and that underpins all of the others. There's obviously overlap and it lines with all those other partnerships, but it really is the initial one that underpins all of those. So our key aims are around having a healthy pregnancy and birth. I'm ensuring effective support for families, families, so they can thrive and develop. Increase mental well-being and resilience of parents and infants and babies, infants and children, to identify issues as early as possible and then provide support for those that need it, to develop a clear integrated offer of support, which Claire will talk about, and to prevent adverse experiences, unnecessary morbidity, mortality, etc. I won't talk through this slide in detail, but this is just an example of the work areas. So as a group, as a partnership, we've looked at the data that's where we're doing well, where we're not doing so well, where we've got certain inequalities, and these are the example of work areas and priorities we're addressing. I've realised that we haven't included a link to the actual plan in your papers, so I do apologise for that, but we will send that round. But that's just to demonstrate we have a plan, that's what the plan looks like, we have priorities, we have a more detailed plan. The key work areas, there are 5 key work areas, so these are the 5 things that we believe are crucial for best start in life and what our partners have said are really important in Worcestershire. So that first year of life is really important. So perinatal health and well-being, mental health is so important, emotional health and well-being, parenting, and also attachment, so to ensure secure attachment. Then The next one is a Start for Life offer, which we as a system are required to do, and the development of our family hubs, which we'll come on to, a focus on improving health outcomes, and a focus around supporting speech and language and child development at that earliest stage. And finally, I think this is finally for me, we have a dashboard. So how are we monitoring what we're doing? So there's a whole range of outcomes and outputs and processes in the dashboard that we review each quarter and will help us review how we're going and identify new issues and priorities as we go. So I'm going to hand over to Claire now to talk about two particular work areas that we've made progress on that impact on all the other work areas, and they're sort of, in a way, the backbone of everything that we're doing in our Best Start in Life work programme. Over to you, Claire.
Thanks. I'll just nudge that over a bit. So the two pieces of work we'll be looking at are the Best Start in Life single point of access web pages and the Family Hubs work programme. So you can see on the screen a snapshot of a draft of our front page of our single point of access. So this is an online access point for information, signposting, guidance and service access for everything through preconception, through pregnancy and the early years. So there's a national recognition through some of the policy work that Liz alluded to, that across the country there are so many kind of services and support offers for parents and new families. As you mentioned, Chris, starting a new family is such a key life transition that it can be a minefield sometimes for new parents to navigate through the different services they'll be coming into contact with, the information and the support that's on offer. So there's a national drive within the policy to develop, for all areas, to develop a single point of access to draw this system of information and support together. So this is our response to that local duty, and there's a web page which is bringing together all of the system web pages, so with the NHS and the Trust and the voluntary sector, the information we've got locally for parents. So this is our local response to that, which will be launching in the next month or so. So as we mentioned, it's part of national policy, and all areas will be doing something similar with their local offer to bring together that information in the early years. All areas are required to have a single point of access. So within our family hub offer, we have a physical single point of access within the communities, within our family hub buildings, which we'll touch on slightly later in the presentation. And also this is our virtual single point of access through the web pages. So some of the engagement that we did locally showed that there's also, as well as the single point to make it easier for families to access information, there's a need for a recognised branding. So there's lots of services that families will come into contact with, whether they're NHS services, council services, community sector services, and they've all got different branding and different organisations. I think families can often feel like there's such an array of services that are going from pillar to post. So within the national policy, there's a need for areas to have a recognised branding to bring that offer. They call it a Start for Life offer, looking at those first 1,001 days. But how can we bring that offer together as a single package for families? So we've got the Best Start branding, which you've seen on the slides, and the action plan. So as well as branding our partnership and the action plan, it's a local branding that partners will be using to brand their offer to families so that they're kind of feeling like they're all part of one team, and how we can bring that system together to support families as one offer, rather than maybe how they possibly can be sometimes within their different sectors and organisations. So we're not looking to duplicate anything with these web pages. There are so many web platforms and pages within services and offers currently across the county. When we mapped it, there's a lot of information out there for families, but you just need to know which door to go through, which can often be hard for families. So this will be providing that single front door to all of the information we have as a system and bringing it together and offering an easy navigatable web page to help people find the doors they need to go through and the information they need to access. It's hosted within our virtual family hub, so people will be aware of the virtual family hub that sits within the council. It's a really well-used platform for families currently, so we didn't want to create a different hosting point for this. This will be somewhere where families are already easily able to access, and it will be the 0 to 5 and the earlier section of that. So as we mentioned, it will cover a lot of information, signposting across a range of topics, whether that's local information, services or national information. You can access services, so whether that's when you first found out you're pregnant, accessing the self-referral point for maternity services, health visitor drop-ins and services and support that they offer within the public health nursing team, the family hubs, lots of different ways in which you can access support and services in our local system. We do find also that from talking to families, one of the key things that they were lacking and always maybe going to social media to try and find is where can I go in my community to support meet other families, to take my babies, where can I go in Redditch on a Tuesday to, you know, go to a baby group, or where can I meet other parents in Wyre Forest on a Friday when I'm on maternity leave. There's so many questions flying around about that type of information. There wasn't a single point bringing that together for families locally. So we've been doing a lot of work across the system to gather information about where are the assets, where are the single points in communities that people can access groups and clubs and peer support. So that's going to be all hosted on the website as well, broken down into district, so it's easily able to access by families. We've also got a whole programme of work which we haven't been able to go into detail at the moment during today's presentation, but there's a whole separate piece of work looking at support for dads. So we know that our services can be hard for fathers and dads and same-sex couples to access. Often dads and partners can feel like a bit of an add-on when the mother and baby are accessing the universal services. So we'll be doing a lot of work to support dads to feel more included in service access, but also there's a platform within the Best Start pages to provide information specifically for dads. All of the groups and community opportunities that we've been developing for dads to provide them more support will be easily accessible in one place on a list within the pages as well. And we will be doing a big promotion campaign to signpost dads specifically to these pages with their own QR code, with their own promotion, so they feel they've got something for themselves, because they often feel a bit of an add-on with that, with the services obviously mainly focusing on the mothers and babies. And as we mentioned, it's also a single point of access for the family hubs. So within the pages you can access all the information about where your local family hubs are, the different services that you can access within each of the family hubs based on the district, and lots of information about how you can self-refer to those service access. So family hubs, so this is a key work programme we've developing across the system over the last year or two. So this is also part of a national policy. There's a family hubs and Start for Life programme guide. So this has been nationally driven over the last couple of years so that all areas can identify and develop their family hub offers. So this is for children aged 0 to 19 and up to 25 with SEND needs. So we've been working across the system of partners to understand what we currently have in Worcestershire in terms of our Start for Life, in terms of our family hub offers, and how we can develop that and progress that going forward. So there's a national guide which outlines 24 service elements that all local authorities should have included within their family hub model. So this is the kind of key elements that you'd expect, such as midwifery and speech and language and health visiting, but there's a range of other services we need to include in our offer, such as domestic abuse support, finance and mental wellbeing. So we've been working with partners to understand what we currently have within our buildings and our offers and how we can develop our system support to better meet that national framework. So here's a couple of pictures of some of our local family hubs. So people may have heard of family hubs, they may know exactly what they are and have accessed them, or it might be quite an unknown concept to them and they may not be aware of exactly what they are. So family hubs, have been developed from some of the previous children's centres. So we've got 9 family hubs in Worcestershire that were previous children's centres back in the Sure Start days. So we've, as part of our commissioned offer, we've got 9 key family hubs within the districts. We'll touch on where they are in the next slide, but they're a place-based way of joining and integrating all of the support for children and families on a district basis. So they're a mixture of universal support and services within the hubs, but also some more targeted support. So you may have, most people would have communicated or been within their family hubs during their maternity journey and had their midwife appointments and their health visiting appointments, but they then may also continue to access the family hubs for speech and language support, mental wellbeing support, baby groups, Healthy Start vitamins, and a range of other things that the family hubs offer. So as you mentioned, they're a single point of access. And they are provided by, there's 3 key partners that provide our Family Hub services at the moment. So Public Health commissions 3 Family Hub providers to coordinate the 9 Family Hub buildings and also that wider offer. So Action for Children coordinate the Family Hub offer in South Worcestershire, Barnardo's delivers the Family Hub offer in Wyre Forest, and Redditch Borough Council delivers the Family Hub offer in Redditch and Bromsgrove. So these are our 9 family hubs. So we've got 3 in Worcester City, we've got 2 in Wyre Forest, 1 in Kidderminster and 1 in Stourport, and 1 in Droitwich, Malvern, Bromsgrove and Redditch. So these are just our core hub buildings. There are so many other buildings within the districts and outreach and satellite sites to family hubs that offer support in the districts as well. But these are our key coordinated points for the family hub buildings themselves. So there are 3 kind of levels to the Family Hub offer. So we've got, as we mentioned, the 9 core family hubs that are within the 9 main commission buildings, but also within each district there are outreach sites and buildings that also deliver elements of the Family Hub offer, whether these are speech and language drop-ins or breastfeeding groups, or kind of a range of baby groups, etc. But libraries, community centres, NHS buildings, there are kind of lots of outreach sites to these family hubs, and they work on district patches as a network to deliver that, which we'll touch on slightly. Also, there's a virtual offer of our family hub support. So through the new single point of access, families can offer information and advice in a virtual way, but also there are kind of various digital methods that family hub services are being delivered. So this is a visual to look at that framework that nationally has been outlined that we need to be what we need to be including in our family hub offer. So the blue boxes in the centre of the image are looking at the key things that are typically in a family hub building. So you're likely to have your midwifery clinics, your health visiting clinics, breastfeeding support, etc. And the themes around the edge of the image are looking at the types of information and support that you'd expect to receive or be signposted to and linked up with when you attend a family hub. So you might go for your midwifery appointments, but you're likely to, if you're needing it, be able to support for housing or mental well-being or health, etc. There's a topic and a range of topics that would come into that family hub offer, and it's aimed and hoped that the partners and services working in that building will be joining up with these services that are within the district offering these services and support. So I won't go through all of these, but again, this is just a list of the types of things to be you'd expect to see within a family hub. So as well as your more obvious ones, such as midwives and health visitors, a lot of our hubs, we're looking at expanding our offer out within Worcestershire, but we've got various services such as smoking support, healthy weight support, breast pump hire. We have a lot of people accessing for Healthy Start vitamins and food boxes. So it's not just your typical core health needs. There's a range of kind of health and well-being and wider holistic needs that people are accessing for support, whether it's looking at clothes banks or food boxes, send support, family learning. There's quite a lot of things that we're including in that family hub offer as it develops locally. Family hub networks are quite a key piece of work that we're developing kind of in the recent months and going forward. So previously we had offers that we delivered within our family hubs, but a key focus going forward is developing family hub networks on a district level. So the family hub providers that we're commissioning to coordinate the delivery in family hubs will also be coordinating now district-based family hub networks. So these will likely be quarterly meetings. They have already started, but they are developing with each of the districts, and they've had really good representation so far. So they are meetings bringing together the range of services that are working with children and families within that district patch. So we do have a lot of services and a lot of partnerships that do work on a district level, but there's been a gap for some time for that type of network that really works with children and families, but on that local patch. So these district networks will be taking a place-based approach to really understand what the needs are of each of the districts. So within each of the patches and around the family hubs, understanding what are the specific needs linked to that area. So we know there are key things we're trying to work on as a county, such as smoking in pregnancy or maternal obesity, breastfeeding, etc. But within each of the districts, there are going to be particular things that are higher or lower across the county, and understanding as a district family hub network, what are their key priorities in each of those areas, but also understanding some of the LSOA analysis and some of the deprivation data to understand where in our district patches do we really want to target families? These are things we really want to focus on within Redditch or Wyre Forest, but within this district, these are the specific communities that we really want to ensure our family hub offer is reaching and targeting. And we have been mapping the locations of all of our family hub services and offers to understand, are they meeting the needs, are there gaps, and what can we do to fill in some of those gaps and ensure that those that are really needing the support are being targeted in the best way. So that was a really quick whiz through of the Best Start pages and family hubs, which Liz said are kind of some of the key framework pieces of work that probably weave through all of those individual topics that you saw on that slide with all the boxes on. But there's just a couple of points to summarise of the key themes that will be coming up over the next few months within the Best Start and the Family Hubs work area. So as we said, we're looking at taking a really district focus to understand the needs and the local assets, to understand how we can best support families on a patch working together rather than kind of within our separate services. So the Family Hub networks are going to be a key backbone to the work we're doing going forward. There's a key theme throughout all of the Best Start in Life partnership pieces of work to look at the inequalities, as Liz said, to understand when we're looking at key priorities as a system, you know, who in particular in our communities are experiencing poorer outcomes, who's accessing services better or less than other areas, and how can we identify the areas that we can really reduce those inequalities. We've got the Best Start pages that we're launching and the new local branding to bring all of the work together. Expanding the Family Hub offer, as we said, as well as looking at that wider network of services. We're really focusing on the buildings and how we can bring more families in. They've got a really high level of footfall. It's been about 40,000 contacts a year. Some of those repeat contacts, but as a network of Family Hub buildings, and we have a high footfall of families, but we want to look at how we can make more use out of those assets, which rooms might be free at different times of the week, and how can we bring more services in, where are the gaps and what we can bring into those Family Hub buildings. Wanting to expand the service offer for fathers and same-sex couples. So throughout all the themes we've been looking at, how can we particularly ensure that fathers and dads are receiving support, because they can often have needs that we're not meeting with our current service offer. Infant and parental mental health is a key theme that runs through a lot of the Best Start in Life work programmes, and there's a particular focus coming up on some of the key pieces of work we're delivering with that. And also across all of the work areas, there's also a focus on community grants, and there's various community grants that we've been developing and working with communities to identify, with all the things we're trying to achieve, how can we work with families and communities in their patches, on their patches, to understand how can they identify ways in which they can help themselves, and how can we support those through community grants. So we've been doing a lot of work with, particularly with groups of dads, to find some things that we can do to support them, and some various bits and bobs around the county that we're doing with grants in particular districts to increase that service offer. And I think that's it.
Thanks, Liz. Thanks, Claire. Before I open up for questions, just a couple of comments from me. First of all, thank you very much for the presentation. I've always believed that this is one of the most important areas of public health, because if you give them the best start in life, then it saves a lot of problems later on in life where needs become more complex. So I'm a great supporter of this. I think I was really pleased to see, and you did home on about it, the single point of access within family hubs. How many times have we gone on to try and find out some information and directed from one thing to another thing to another thing, and having a single point of access for all that information that you showed us there, I think is absolutely ideal. And I just wanted to also say, well done on having some dedicated support for fathers and same-sex couples. Excellent. Yeah, too often they feel left out and isolated, so well done on that one. And of course then, the community grants. I've seen the results that the community grants do myself, so it's an excellent initiative, and it's helping communities to help themselves. So there we go. I'm going to open up for questions. Do we have any questions for yep, thanks, Simon.
Yeah, thanks, Claire and Liz. I mean, look, you should be commended for the work you've done at tidying this up. I think the offer became a bit disparate and a bit hard to understand, and this is a real step forward. I was just reflecting really on the previous conversations in the meeting about inclusivity, how can we support kind of neurodiversity and help people at source rather than the reliance on, oh, you need a referral, you need a formal assessment? It's just, I suspect we will often come back round to, actually, is there a greater awareness support offer that we can do through these types of services rather than the system just having a pathway which is just going to result in a long queue. So just interested in your reflections on that specifically.
Yeah, thanks, Simon. In the Best Start in the Best Start in Life work programme, the priority around child development and speech and language, and etc., really does focus on some of that. So we're looking at how together we can identify issues earlier, and then what support is available. So not just services, but what support's available in the family hubs, in assets, in local communities. And as part of the family hubs that Claire talked about, baby groups and stay and play, but there's also peer support groups. So the providers that we commission them to help others to help themselves in that respect. So if they identify parents of neurodiverse children who say there's a gap in this locality, then they're encouraged, they support them, take them along the journey, and then encourage them to have those kind of parent groups or peer support groups, and then the parents might run them with their help, and then it gets established and maintained. So yes, absolutely, we will be working alongside the pathway and the main services.
I mean, I think, Adam, it's probably something we should build into the improvement work, because this, as you said, David, it's starting right at the very beginning, and it is the best preventative health and wellbeing strategy we have to get the family support offer right at the very beginning. So, look, I think that's really, really encouraging.
Chris.
Thank you, Chairman. Excellent report, and it's so good to hear that this work is happening. Absolutely, the family hub is the right way to go. One point of contact takes you everywhere. However, my question is very specific, and it's when that information doesn't get out there. You were talking about emergency food boxes. Most people's first port of call when they're desperate is going to be a food bank. Do you have any tie-up with the food banks?
So the family hubs have close connections with their food banks. So some of the family hubs have the actual food boxes, but all the family hubs will have networks and links within their communities to link up a range of wider needs. The food banks is often one that they do refer to. I think they have the vouchers that people can access at the actual family hubs. Most of them, not all of them, it depends on their local offer, but a lot of the hubs have the vouchers that people can access. And as well as the kind of food poverty, as we said, the wide range of needs, whether it's domestic abuse, substance misuse, the range of holistic needs that come along with families and kind of starting new journeys and life transitions. There's a range of support that they link with that whole community. So much wider than just kind of food banks. So yeah, they're that single point to most things that families would need. If they don't support them directly, they'll be able to link you up with who will be able to.
Yeah, thanks. Simon stole my thunder rather, because that was sort of what I was going to say. And yeah, absolutely, you're absolutely spot on, Simon. These are right in the heart of communities, these things. And we know that when we take services to people, we improve access, of course, because there's less barriers. And when we improve access, we improve early, timely access. And so the point I was going to make is exactly what Simon said, that we really hope that the whole system will, they already do this, the system already does this, but let's think about more ways in which services, which programs, just information can be delivered through these family hubs. So that when people walk in, they get more than they bargained for. They might come in for one reason, but come up with a whole host of new support links, new information, new advice. And it's the same idea as Healthy Worcestershire. You know, we put hubs in the heart of communities, but we don't just want it to be public health services in there. We want the whole systems, programme and services, including, of course, our voluntary sector partners, to be utilising these hubs. We've got 30 healthy Worcestershires around the county. We've got 9 family hubs. There can't be many areas in the country that have that sort of in-reach, that sort of presence in the heart of communities around health improvement. So I think, to echo Simon's message there, let's really use that asset that we've got. And just saying, but 75 local authority areas receive funding for family hubs. We ain't one of them. No. Liz reminded me of that on a daily basis when I first started, and she's quite right too. So how proud can we be as a system of what we've all co-created there? On the Best Start pages, again, we're going to have to work as a system to promote them. You know how difficult it is to get at the top of the search engine results, to get to be the first thing that comes up. And obviously we'll work with comms to do all the SEO work, etc. But I think having the links on all of your websites, talking about it at meetings, public meetings especially, let's all try and promote it, because the more we promote it, the more it acts as an effective single point of contact. And I'll finish by saying to Liz, this is your legacy here, among many other things, and we promise we'll look after it, because I know how much trouble we'll be in if we don't. So this is something that you personally, as a professional, should be extremely proud of, and thank you for everything you've done for the Best Start in Life programme in particular.
Thanks, Lisa. And can I echo what you just said? I mean, I'm reasonably new to public health. Only kind of joined the team in June, I think it was, of last year. Of the 2 areas that I'm most kind of proud of within public health are the work we do in the communities. And both Best Start and Healthy Worcestershire tick both of those boxes big time for me. And I'm very proud to be associated with public health and with those initiatives. So thank you very much, both of you. Thank you. Are there any other questions? There is. Thank you.
Thank you, Chair. I'm Monica Stringfellow. I'm a councillor from Redditch Borough Council. I just wondered if you can help me out with a question about starting well in Redditch. I believe there are going to have to be some changes due to perhaps some funding issues. There was possibility, I heard from an officer, that there may even be redundancies. Are you able to give me any sort of update on that, please?
Yes. Where to begin? Starting well is actually a contractual relationship. It's a contractual agreement between the Health and Care Trust and the 3 organisations that deliver the family hub services that we've just talked about. And the trust subcontracted, currently, the trust subcontracted those 3 organisations. And everything that we've talked about today, we've got is a new way of working and a new model, and we're recommissioning all of those providers, but separately. So that subcontracting arrangement is ceasing. So we're commissioning the trust to provide health visiting school nursing, and we're commissioning those 3 family hub providers to provide family hubs. And so the term starting well will no longer be, because their contractual relationship is ceasing, and it's being replaced by Best Start Worcestershire. But the funding is exactly the same. So exactly, it's the same amount, same funding envelope as there was before. So I'm not sure where your information has come from, other than they're all internally they're issues.
Sorry, can I just come back on that?
Yeah.
So what my understanding was that the funding was going to stay level, and therefore, because prices had gone up, it would equate basically to a cut in funding. That was my understanding from the officer that discussed it with me.
Yeah, that's correct. The funding has remained the same.
I think that is the nature of things at the moment. As you know, local authority settlements just don't cover the increased costs. And however, what I would say about Redditch in particular is we are investing an awful lot into the the communities of highest need in Redditch. And even though it's not been signed, it's not complete yet, we're looking at investing an extra 90k into 3 voluntary sector organisations, particularly to work around the Winyates area. Also, Redditch came out in our LSOA analysis, as you'll know, Councillor, as an area that is producing high levels of service demand because of unmet need. So I guess what I'm saying is I can give you my personal commitment that investment from public health and preventative services into Redditch is only going to grow over the next 12 months, and I'd be happy to keep you personally updated on what we're doing. And in fact, I think we're coming to Redditch Borough Council scrutiny panel soon to talk specifically about that. So while we haven't been able to increase the contract value of the family hubs, just like we've not been able to increase contract values on any of our contracts, really, we've protected the funding, which was a bit of a feat in itself, to be honest, because a number of contracts around the public sector, as you know, have decreased, but we're going to be putting extra investment of time and money into Redditch. So I'll keep you fully informed on that.
Thank you, that's really good news.
Yeah.
Thank you, Lisa. Thank you very much. The next item in that case is no further questions. Thank you, Liz, and thank you, Claire. Thank you very much indeed. Thank you. So the next item on the agenda is agenda item 8, future meeting dates to note. You'll see that they're there for you. The public meetings, first one is on June and then going through to next year, and the private development meetings, next one being on the 18th of March, and just there for noting. With that being said then for being no further business, I call this meeting to an end, and thank you all very much for your attendance. Thank you.